Eager young medical students from Stellenbosch University immerse themselves in discussions with lecturers and staff at Tygerberg Hospital over organ transplant. Listening attentively, they identified a simple solution to a serious problem. Now, in their 5th year, they managed to raise enough funds through collaboration and partnerships to establish what was needed: a separate, fully equipped space to prepare for organ transplant, but to also provide families of donors privacy to mourn. 18 months later, the Save 7 NGO officially opened the first life pod.
We don't have enough ICU space in a traditional ICU in order to handle brain-dead donors when they arrive. And what this means is that the 7 people who would have been saved by one donor have to go and find another organ, and they often don't. And that's why we need rooms like this. We need space where they can be nursed, and we need space to give the families dignity during this process so that this miracle of transplantation can be unlocked. Because we have the medical resources, we have the surgeons, we have the nurses. We just needed the space.
The question of organ donation is a very sensitive matter for families. After a loved one has been declared brain dead, highly experienced and empathetic personnel will guide and explain the option of organ donation. Informed consent must be signed before the process of harvesting and transplant can begin.
After consent, we will move to this beautiful room where we will work up, we call it donor workup process, where we will test every organ so that we can use to transplant to our patient who are years on the long waiting list for a heart, for a lung, for a liver or a kidney. So the donor workup will then be much easier done in a comfort care room for our donor and to give family support.
7 people's lives could be saved by the donation of big organs such as the heart, lungs or kidneys. Tygerberg Hospital conducts kidney transplants. There is a severe shortage and dire need for suitable organs. The waiting period for a transplant could be years.
In the renal unit currently, we are almost 150 patients that wait on life-saving organ. We only do kidney transplants, so the 150 is waiting on a kidney transplant. But the main problem is that if we don't transplant, we cannot accept new patients on the program. There is a certain amount of patients we can accept on the program, on the chronic program, and we reach that amount of patients, we cannot really transplant. We cannot really accept new patients on the program. So serious is organ donation.
If proven successful, with the assistance and guidance from organizations like the Health Foundation, the Save 7 project is hoped to be expanded to other public hospitals across the country. Mariska Botha, SABC News, Cape Town.